Hi, welcome to this edition of The Insider. I'm Scott Bremner. You may find this hard to believe by looking outside, but it is spring in Erie, and soon the warmer weather will be here. And with that, people get outside to work in the yard or garden or, of course, swing a golf club. But if you've been sitting around all winter, what can you do to lessen the chance of injury when you suddenly become active again? Today we speak with physical therapists about just that subject, the focus of our half hour. Starting us off today is Ehren Trost. He's with Active Care Physical Therapy. Thanks for being with us.
Thanks for having me.
What are some of your concerns about this time of year when you may have folks that have been sedentary for a few months that are suddenly, hey, I got to move the patio furniture or cut the grass or maybe get out the golf clubs?
Well, that's exactly it. The sedentary situation that you have in Erie is very difficult for people. In my practice, the biggest thing is to avoid that sedentary period. I recommend a lot of patients to think about getting that walk at the mall. Think about purchasing a treadmill and stay active throughout the winter season. You have your golfers, your spring cleaners. Everybody should participate in some sort of activity that maybe simulates some of the things that you'll be doing once spring occurs. Golfers, I say, hey, maybe take that dry swing in the basement, or go outside on a not-so-bad day. Keep the flexibility. There's no reason to totally stop, even though you can't get on the course.
A lot of times these are pretty specific movements, are they not? I mean, it's kind of difficult for a golf swing to kind of replicate that in kind of anything else that you're doing, walking stairs or going to work, whatever. It's a very specific motion, is it not?
Yes, very specific. And that's why I think you find a lot of people that do, go to the hitting range, practice a swing, or just do, again, dry swings in the basement or in the outside is a good idea. You can do some stretches, rotational stretches. The biggest thing is being able to rotate your spine. When you sat and not done that for months on end, and then you go to do it very suddenly, very forcefully, that's when problems can develop, and very quickly.
We're, traditionally speaking, and I don't know if this is part of the kind of national obesity issue that America has, but it seems like quite a few problems center on the back. Is that fair?
Yes, probably the most common problem.
And is a lot of that weight related, and the people between inactivity and the fact that they may carry more pounds than they need?
That's a great question. They've done studies looking at the weight issue, and weight alone has really does not have a very good correlation with back pain. So I kind of would have to dispel that myth.
There's a lot of and again, this is just anecdotal evidence, but there's a lot of things that it seems to creep up on people very quickly or very unexpectedly, where somebody will say, I went hiking around the peninsula and I didn't have a problem in the world, and then I bent over to pick up something in the shower and my back went out. Is there a lot of rhyme or reason in terms of what happens with your back?
There is. I like to use the example of car tires. One day you're driving down the road and the car tire blows. Well, what happened? It was fine yesterday. What we don't see is that it was slowly wearing out. Maybe the alignment was incorrect. That tire is getting worn out until finally it blows. Nobody pays attention to the warning signs until something drastic happens. The same thing is happening with your spine. Slow things develop, and they're usually undetected. Then once you stress it too much, or you hit that pothole or whatever, the tire goes, or boom, your back goes just from bending over once, you would think. But really, problems have been developing, steadily over time. Physical therapists, we're uniquely positioned to take a look at people, assess what problems they might be developing even before they happen, and prescribe you just the right exercises you need to prevent, or if you're already in the situation of back pain, figure out what exercise specifically you need to fix your back pain.
I know you advocate stretching and trying to do things over the winter, but let's focus not over the spilt milk, but what happens now. This is April, and it'll probably be just in a couple of weeks where folks are going to start getting out and doing some of these things. Is there anything somebody sitting watching right now can start to do? Is it never too early to start, I guess? Is that a decent phrase?
Yeah, once you're in the situation, the common sense things, pace yourself. It's the repetitive motions or the sustained positions that are going to get you. If all of a sudden you want to go out and rake the entire yard, you're going to develop a shoulder problem, possibly knee, possibly back, if you try to do it all at once. Break it into pieces, do a little each day. At the first sign of pain, just back off and end it that day, go back the next day. If the pain is worse, then you might want to give a therapist a call.
Is it difficult to know? I know when I first start out, when I go to the Y or the gym or wherever I'm going, I'm not really sure. I know I have to take it easy. I know I can't push it. But it's kind of hard to find that line. You know, am I really getting the maximum benefit of my time spent? Am I underdoing it? Or am I pushing too hard too soon? It's not an easy thing to determine, I guess, is what I'm trying to get at.
Well, you're correct. And it depends if you're going into it with an injury already. If you have no injuries, you have no problems, you might be okay with the trainers at the center helping you. But if you have an injury or something specific, you really should start with a physical therapist who can deal with the injury and understand how that's going to affect your ability to participate in whatever exercise you want to do. Or better yet, they can develop a program for you. And
one of the things that I've heard is if you hurt your arm, you can work your legs. Or if you hurt your leg, you might be able to work your upper body. But if you hurt your back, you're done.
Yeah, it can be that difficult. That's why we try to get people to address their back pain very quickly. The quicker you would see a qualified therapist, the faster you can end that episode and get on with the fitness. I think that's a big part of my practice is finding these folks that want to lose weight, want to participate, but just because of injury, they just can't find that right thing to do. I have a patient now who hasn't been able to exercise in 15 years, and we've been able to find the right exercises for her to avoid her back pain, hip pain, neck pain, ankle pain. She has all these things going on, and here she is 28 pounds less, and her pain is better. So on your own, that might be a hard thing to overcome.
All right. Well, on my quest to continue to get free medical advice, I will tell you that we are going to take a quick break. And when we return, we will talk more about what we can do to prepare ourselves for the warmer months and getting outside and being active. Stay with us. Welcome back. Hopefully you were with us in the first segment. We have been talking about it's getting warmer, believe it or not, and we're going to be outside doing more things, moving around patio furniture, raking the yard, maybe doing some mulching or whatever. How are we going to do that in a safe manner? Ehren Trost joins me with Active Care Physical Therapy. A little later on, we will talk a little bit more about golf swings, which I have a particular interest in, not that I can do it necessarily well. We were talking in the first segment about back pain, and that seems to be, I'm a layman, but that seems to be one of the major areas. Is that fair?
Yes.
That in America we have a lot of back pain. One of the things that some people have talked about is the idea of using some kind of brace or some kind of help for you to do that. Do you advocate if somebody's going to go out in the yard that maybe hasn't done anything in the wintertime to maybe get one of those belts or braces that might help them back?
Sure. There was a school of thought probably 10, 12 years ago where these braces were the thing to do. They would protect you. But the research that has occurred has really shown that the injury rate with using those braces has increased. We call it the beer muscle effect. You put this brace on, you become indestructible, and you might tend to take on things that you shouldn't. So we don't advocate the lumbar or the lower back braces for that reason.
A lot of like car seats and even ergonomically correct work chairs have that comes out at the bottom, so it kind of pushes in the small of your back.
Right, a lumbar support. Yeah. Sure. Yeah. We don't advocate those. I mean, posture, yes, but posture that is naturally occurring. We teach people how to have good posture, what it feels like to have good posture, and how to modify their workstation. For example, is that chair have enough support for you? Is it the right height? How do you know that? And especially when you have pain, now what do you do? I think I'm in good posture, but my back still hurts. I sit all day and the back hurts all day. What do you do? And that's where physical therapists can really be very, very valuable.
What about the information and just knowing kind of a correct way to do something? If you're shoveling particularly, you always hear, bend your knees, get down instead of getting over something. There are a lot of people that'll get a couple of yards of mulch in their front driveway, and they'll get the little wheelbarrow out, and you talk about repetitive motions, they'll sit there and over and over again do something like that. What are your concerns, and what do you tell people in terms of, okay, what is a correct or an incorrect way? Because most people know how to shovel, but what do you mean I'm not shoveling the right way? But to mitigate the chances that you might be injuring yourself while you're doing it.
Well, the correct way is if you have children, make them do it.
Exactly.
The correct way, obviously bend the knees. You want to keep the back straight. If a normal person standing has a little hollow in their lower back, That's called a lordosis. You want to maintain that, especially when you have load or when you're lifting. Once you lose that lordosis, then your back pressures within the spine can get out of control, and then that's when you're going to have your problem develop very quickly. So we maintain that position while you're doing things. So yes, it involves bending the knees, and especially when you're repeating over and over, you've got to really focus on that posture.
How big an enemy is gravity? Because you see some of these things where you have these things where you can hang upside down and do different things, because of the compression of the spine, just because the world is pressing against you as we go along.
Sure. Well, we evolved in gravity, so our body and our discs in our spine were designed to take it. What happens is that we, as people who live in a society where we have to work and we are forced to be in a position too long to get that paycheck, you kind of forget about, who cares about gravity? I've got to eat. So we do things that in a sustained way that maybe we shouldn't, but you don't have a choice. Now, when you get outside of that, then we can start to think about what exercises can I do to counteract gravity. And the inversion tables can be very beneficial for a certain group of back troubles. The thing that people don't understand about back pain is that there are 100 different flavors of back pain. How do you know which one you have? And each flavor requires a different treatment, a different exercise, a different modality, which is a treatment. So physical therapists, again, especially those certified in the McKenzie method, as I am, can identify what movement or exercise, position, stretch you need. Because for you to pick out something from a magazine or something, that there's 1,000 experts out there that all tell you something different, but they don't know what kind of pain you have. Only of somebody who can really put you through a process of determining your type of back pain can really tell you what you need to do. Generic treatments don't work, and that's why we have such a problem with back pain in America.
All right, well, we need to take a break. When we return, we're going to be talking a little bit about your golf swing, or maybe getting out in the yard and having the correct way to do some of these things so you don't hurt yourself. Stay with us.